Yeah, my name's Marshall Watson. I'm a Noongar man from the southwest of WA, and I'm a child and adolescent forensic psychiatrist. We also sit on the college's subcommittee for Aboriginal and Torres Islander mental health. And this afternoon we're presenting on cultural knowledge within clinical systems and looking at really about how culture impacts upon clinical practice. We know that Indigenous people are overrepresented in the system, and clinically, while things are done well, but there's also a big gap around cultural knowledge and how we implement that, but not so much a gap, but about how we could use that knowledge better to actually further the needs of Aboriginal people. And within the college, on the committee, we sit here as a committee of Indigenous people. We represent our own communities around Indigenous issues and use that information to help guide the college in the way of advocacy and moving forward for the needs of Indigenous people.
What are the big challenges there for psychiatrists in doing better care?
Look, I think everyone struggles with Indigenous mental health. Not that it's hard, but I think that it's complicated, and that it is. But I think certainly we have the clinical knowledge. It's about how do we use cultural practice to actually weave through our clinical practice to actually improve outcomes for Indigenous people. And a lot of the stuff that we're dealing with and the people we work with deal with is things like complex developmental trauma, substance misuse, overrepresentation in custody, and so forth and so on. And there are lots of not just clinical issues, but there's also a lot of social issues and emotional well-being issues. So we have to think beyond the remit of just mental health, but also about holistic care and what that looks like from a psychiatric point of view, but also how we engage with communities to do that as well and help to not just work with people, but also work with caregivers and communities to help enhance their capacity to actually improve outcomes.
And where have you seen that happen well?
Look, I've seen it happen well in various different sort of areas, and particularly where there's good Indigenous representation within clinical services. And that's not to say that services, I think any service can benefit from ongoing cultural input and engagement, but it's about how you engage and use your Indigenous workforce. And I think where that's done well is where you see some steps forward. We've still got a long way to go, but that's not just a problem for Indigenous people or psychiatry or mental health. That's a problem for everyone to work together to move towards.
Fantastic. I would keep you talking, but you've got to go present.
Thank you.